It is like the Wild West, I promise you. Listen, I'll be very quick. I won't even use my full 5 minutes here. So obviously, as someone who's just literally in the last few weeks finally signed off and passed and, you know, got my PhD on Medicare claiming and compliance, I can confirm what David said, that the operation of the health system, in particular the funding, so that my area is health financing, it's both complex and not well understood. 100% agree with you on that, David. It is like the Wild West. It's very, very messy. It's actually quite badly broken, but not beyond repair. I'm talking to you, these are findings from my PhD. I wish I could have really positive findings, but I don't have that many. But I do have 27 recommendations for reform and ways we can plug some of the holes and make things a lot better relatively quickly and easily. But I think the key thing for this forum here for everybody to understand is that Medicare's in bad shape at the moment. And we will not be getting more funding from the federal government, I don't believe, anyway. In fact, I think as a taxpayer, it would be irresponsible for the federal government to sort of pour more money into funding, even if it's for services that we all want and need, until such time as we give something back to the federal government. And what I'm talking about there is visibility. The key problem for Medicare has always been there is a gap between clinical information and billing information. Those two things are completely separate and they are not anywhere else in the world. So the work that I do in other countries. And in other countries, when we bill, the first thing we do is we have to allocate an ICD code, which is a diagnosis code. And that gives the payer information about why the patient was there. So then if someone does a 40-minute consultation, the government's got information that they can sort of match. So they can do things like say, well, if the patient came in for a repeat script, why did it take you an hour and a half? Why did you bill a really long consultation? The patient said they came in for a script. What's going on? And in the rest of the world, that's the way we do it, not in Australia. And we have to plug that gap. And maybe it's an opportunity. Maybe it's an opportunity for this forum to put our heads together and like run a trial, a pilot, put something to the federal government and say, we will give you the visibility we need in the Northern Territory. We'll add SNOMED codes into every MBS claim so you can see what's going on. Maybe that's a solution. So Medicare, you know, without just thinking about standing in the federal government's shoes and the problems they've currently got with Medicare, without standing in their shoes and coming up with the solutions, we won't be able to press forward with, you know, the funding that we need. Voluntary patient registration, David, that was a late entry into my PhD. I've been following it, and literally the day I was about to, it was all being signed off, I just added a quick little section saying I've read what they've written and I'm really worried about it. Based on the current model in that document, the 10-year plan, I'm very concerned and I don't think it's going to be great for the bush. In fact, I'm pretty worried about it. I think it's going to reduce access. So it's probably something that needs further work. So it's not a lot of good news there, but it's all fixable.